Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to talk about Hallux Valgus deformity, better known as bunions. We're going to be going over what the condition is, potential causes for it, as well as briefly reviewing the classification for severity. We're also going to talk at the end on whether pain and loss of function is actually associated with the severity of the deformity. Hallux valgus deformity is a progressive condition. This means that over time, it tends to become worse, it tends to become more painful and more limiting for people. Hallux means the big toe, and the valgus deformity means that the big toe starts to deviate laterally or outward toward the pinky toe, while the first metatarsal starts to deviate medially or inward toward our midline. This is what forms that bony prominence medially toward our midline, and this is what can become painful for some people. There are potential causes that are both extrinsic or external and intrinsic or internal. Some extrinsic factors include the footwear we choose to wear. If we wear shoes with a narrow toe box or heels, it is going to kind of smash those toes together, making the big toe deviate laterally. And if you're wearing heels, then you can imagine our whole body weight is kind of pressing on that area where the toe is deviating laterally. Likewise, anything that causes increased weight bearing or stress on the joint when it's in that position, this could be even just the way that you walk. This can also be an extrinsic factor or a potential cause. For intrinsic factors, we have genetics, age, so those that are older than 50 years old tend to be at higher risk. Gender, so female gender tends to be a higher risk. Ligament laxity, which is sometimes linked to the female gender. If your ligaments are more lax, you may be at higher risk to develop this condition. Also, if some people have certain foot conditions, such as pes planus, which is flat feet, or other medical conditions such as stroke or cerebral palsy, those could increase your risk of developing this condition. Let's go over the classification for the severity of the deformity. The traditional method is using radiograph imaging. We're going to look at something called the Hallux valgus angle, or HVA. That's the angle between the first metatarsal and the first proximal phalanx. And we're also going to look at the IMA, which is the intermetatarsal angle. This is the angle between the second metatarsal and the first metatarsal. Now, based on these angles, it's going to be classified as either normal, mild, moderate, or severe. So you can see in this table, these are some of the values that are within the traditional classification system. There's also a newer classification system that considers the triplanar nature of this deformity. So just like scoliosis and other deformities in our body, it's not just in one direction or one plane. Oftentimes it's a 3D deformity. So for this triplanar system, we're going to look at AP, which is anterior, posterior, or front back, lateral, and axial radiographs to classify this condition. There are types 1, 2A, 2B, 3, and 4, and the different things that they consider are the HVA, IMA, whether the first metatarsal is adducting or pronating, sesamoid subluxation presence, as well as joint degeneration presence. And we don't need to go over what each type is. This is something that you could easily find online. Lastly, in this video, we want to talk about whether pain or loss of function is actually correlated with the severity of the deformity. And the good news is it's not always correlated. Some people, they have what we call severe classification, but they don't have any pain, they don't have any restriction in their daily life. While others may fall in the mild classification, but they have more pain and experience more restriction in the things they need to do. This is actually a trend that we see with many conditions. There are many people who incidentally find a disc bulge on MRI, but they're completely asymptomatic and they're actually being seen for something else. Likewise, many things that we find incidentally on imaging, such as labral tears, rotator cuff tears, even meniscus tears, some people are completely asymptomatic, and that comes to a surprise when they actually see that on their imaging. And likewise, some people have a lot of pain and a lot of limitation, but when they get imaging done to find the answers, that it's unremarkable and they're not able to see any reason for their pain on the imaging. Imaging, it has its time and place. It's very useful, especially after a traumatic event or if we need to rule out some emergent condition. However, we do want to be mindful of the weight that we place on imaging when it's something that we incidentally find and we have no symptoms. Stay tuned for my next video. I'm going to continue talking about Hallux Valgus. We're going to go over what the current research says about treatment options. We're going to go over some treatment exercises as well as some considerations if you have this condition. I hope you enjoyed this video. If you did, like and subscribe. See you next time.